Welcome to today's lesson on listening. This is our first lesson in a new unit on HIV and AIDS. Over the course of this unit, we will discuss the impact of HIV and AIDS and also learn about its prevention and treatment. We will read about some myths related to HIV and AIDS and discuss how these myths came about. We will begin by listening to a text about how HIV is transmitted. If you are ready, students, we will start the lesson. I am sure that the topic of HIV and AIDS is familiar to many of you. Although this disease affects millions of people around the world, sub-Saharan Africa is more heavily affected by HIV and AIDS than any other region. In sub-Saharan Africa, an estimated 22.5 million people are living with HIV. In some countries, more than 20% of the population is HIV positive. Many people still do not understand the facts about the disease. That is why it is important to study how it is spread, how it can be prevented, and how it can be treated. Students, please turn to pages 97 and 98 in your textbook. Here you will see a quiz about the HIV and AIDS virus. If you have not already completed the quiz, we will take a few minutes for you to look at it now. Teacher, please separate the students into small groups of 3 or 4. Students, in your groups, discuss the answers to each of the questions. Choose as many answers as you would like to each question. More than one may be correct. You may begin, students.
Students, let's get ready. Begin. let's get back to our lesson.
Welcome back, everyone. Please keep your answers handy. As you listen to the text, check to see if you were correct. Are you ready to listen, students? HIV is a virus, and viruses in the body are difficult to kill. When it enters the body, it destroys the immune system, which protects our bodies against disease. The virus is transmitted or passed from person to person in one of 4 bodily fluids: blood, semen, vaginal fluid, and breast milk. It has to get inside the body and into the bloodstream. It is not transmitted through vomit, urine, saliva, feces, or pus. There is no evidence to show that the virus can be transmitted by mosquitoes. The virus is usually transmitted during sex when the delicate skin in the genital area is cut. This causes bleeding that you may or may not be able to see. It can also be transmitted when blood from a cut of an infected person enters a wound of an uninfected person. So, if you are treating a wound on another person, if you don't know their HIV status, you should use plastic gloves or put each of your hands inside a plastic bag. The virus cannot be caught in swimming pools, as it cannot survive in water. Neither can it be transmitted by touch. Having sex outside marriage is risky. You cannot be sure that someone is HIV negative unless they have had a test. Even someone who has never had sex may be HIV positive because they may have picked up the virus in some other way. Condoms are relatively safe and certainly better than nothing, but they are not 100% reliable in protecting against HIV or pregnancy. Even someone who is HIV positive should be careful, not only because they could infect someone who is HIV negative, but also because they can be infected with a different and possibly stronger strain of the virus by having sex with another person who is HIV positive. There is no cure for HIV and AIDS. Having sex with a virgin is definitely not going to help in any way at all. A traditional healer cannot cure it either, although a healer can help when someone with HIV gets ill. The only proven treatment is the drug ART, which has to be taken regularly. A healthy diet and lifestyle are also important, as they can help those who are HIV positive to fight infections and be as strong as possible. Students, were you able to hear all of the correct answers? Please take a few minutes to review the quiz and make any of the necessary changes. Then we will go over the correct answers together.
Students, let's get ready. Begin. Time's up. Let's get back to our lesson.
Hello again, class. The correct answer to question 1 is B. HIV is transmitted through the blood of an infected person. It can also be transmitted through sexual fluids and breast milk, but not through just any body fluid. The correct answers to question 2 are D and E. The HIV virus can be transmitted by having sex with someone who is HIV positive or by touching a wound on someone who is HIV positive. If there is a chance that the blood or sexual fluid of an infected person can get into the blood of an uninfected person, there is a strong possibility that the HIV virus will be transmitted. The best answer to question 3 is B. It is safe to have sex with just one partner as long as both of you have been tested. Answer C is a relatively safe situation, but remember that condoms are not 100% reliable. Question 4 has several answers that are correct. Abstinence is the best way to beat the virus. But if you cannot abstain, you should always use a condom. If you are HIV positive, then you must take the ART drugs regularly. Having a healthy diet and lifestyle will also help you to fight infections and stay strong. Having sex with a virgin will definitely not control the virus or make you any less sick. Students, did you answer the quiz correctly? You can see that there are still many myths about how HIV is transmitted and how it can be treated. Together, we will learn the truth so that you are able to share your knowledge with others in your community. In our next lesson, we will practice speaking about HIV and AIDS, and we will learn different social expressions for saying no. Until next time, thank you, teacher. Thank you, students.